Okay.
So hi, y'all. Let me go to the professional page and make sure so I can see if there are comments and questions as we're going. I am Dr. Ashley Maltz, integrative medicine physician at West Holistic Medicine and the founder of the Austin Wellness Collaborative. And this is Lexi. You can see her licking the air, just so you're not going crazy. There's an animal down here. And we are interviewing or going to hear a presentation from the incredible Beth Shirley of Berkeley Life Professional. She's a registered pharmacist and certified clinical nutritionist, and she's going to talk to us about the role of nitric oxide in functional medicine outcomes. So I'll take it away, have you take it away, but let me share my screen for you. All right. Can you see my screen, Beth?
Yes.
Okay. I'm going to make that full screen and
central role.
Yeah, let's just jump right into it.
Today we're going to talk about the central role of nitric oxide in functional medicine outcomes. I am Beth Shirley. I am a compounding pharmacist and a certified clinical nutritionist. So why is nitric oxide essential? It regulates all cardiovascular function and homeostasis, circulation and microcirculation, which means nitric oxide touches every single cell. It's critical to sexual function, the vasodilation, and innervates erectile tissue in men and women. The red blood cells require adequate nitric oxide in order to deliver the oxygen to the cells. Supports neurotransmitter function, regulates the gastrointestinal function, including gastroparesis, the mucus layer, the circulation to absorb the nutrients, helps activate the GLUT4 receptor in order to translocate and bring glucose into the cell. It controls the efficiency of the mitochondria in the generation of energy and the generation of hormones. Pregnenolone's metabolism starts in the mitochondria. It's required for stem cell mobilization and differentiation. Regulates the immune system function, regulates the inflammatory response, and scavenges free radicals. Modifies platelet activation and aggregation. This is a clotting issue. And supports telomerase activity and this has everything to do with longevity. So how do we make nitric oxide? We've got two different pathways. The first pathway, the arginine-NOS pathway, oxidizes arginine and oxygen through the NOS enzyme to make nitric oxide. And finally, it oxidizes into nitrate and nitrite. And then we've got the nitrate pathway. So we've got the nitrate and nitrite from the arginine pathway, plus whatever we get in our diet or supplementation. The nitrate is swallowed. So it goes into the circulation, gets concentrated in the salivary glands. The salivary glands release the nitrate, and we've got good anaerobic bacteria on the dorsal aspect of our tongue that has nitrite reductase capacity. So these bacteria will reduce that nitrate to nitrite. The nitrite is swallowed in the acidic environment of the stomach. Some of the nitrite is reduced further to nitric oxide, but most of the nitrite is absorbed, circulates around, and we have different nitrite reductases in tissue to make nitric oxide on an as-needed basis. Hypoxia stimulates these nitrite reductases as well as acidity. So as we age, our ability to make nitric oxide through that eNOS pathway decreases. And with the first graph, you can see that as women, we hold on to our ability to make nitric oxide a lot longer than the men, till we reach menopause age. And estrogen stimulates that eNOS to make nitric oxide. So as we age, our ability to make nitric oxide decreases. By the time we're 40, it's about 50% capacity to generate nitric oxide. By the time we're 60, we're only able to produce 15% of the nitric oxide that we were producing when we were 20. So that is why it's so critical to support the nitrate to nitrite to nitric oxide pathway to optimize the nitric oxide and prevent all these cardiovascular complications. So what are the factors affecting nitric oxide production? Aging, we just talked about that. The diet, the standard American diet, devoid of nitrate-rich veggies. Exercise or the lack of. Exercise increases our production of nitric oxide. We have the myoglobin has nitrite reductase activity to increase when we need it. Medications, antidepressants, antibiotics, NSAIDs, birth control pills, PPIs decrease the production of nitric oxide through both pathways. Pollution, anything that increases oxidative stress, decreases our production of nitric oxide. Even glyphosate uncouples the NOS enzyme. So what I mean by uncoupling the NOS enzyme, when it is uncoupled, it becomes a superoxide generating enzyme instead of a nitric oxide generating enzyme. And when you're increasing the oxidative stress, this actually uncouples that NOS enzyme even more. Genetics, and I'm not just talking about the NOS, the NOS SNPs, anything that increases oxidative stress, your SOD SNPs, catalase SNPs, your HFE SNPs, anything that interferes with the production of BH4, your DHFR SNPs, your QDPR SNPs. If you've got any type of MTHFR SNPs, you are by definition nitric oxide deficient. And then we've got the big one, stress. Stress uncouples the NOS enzyme. So nitric oxide in stem cells. Stem cells are unprogrammed, unspecialized master cells, which have the potential to develop into other kinds of cells. So they help repair the body. They are required for our body to heal. But they require nitric oxide. So nitric oxide supports stem cell viability. It regulates stem cell differentiation, stimulates their proliferation, and supports the migration. So nitric oxide is essential in order for stem cells to go to where they need to go and do what they need to do. So hyperbaric oxygen therapy increases nitric oxide. This affects certain enzymes in the bone marrow, which then stimulates these enzymes to release stem cells. It stimulates the bone marrow to have increased stem cells. So aging is a loss of hormones, and aging is a loss of nitric oxide. This is an awesome diagram. So this shows how nitric oxide is affecting the brain to stimulate the production of hormones, which go on to stimulate other organs to produce more hormones that positively impact eNOS to increase the production of nitric oxide. So as you can see on this, there's only two hormones that negatively affect eNOS, and that's your glucocorticoids from your stress and your prolactin. So thyroid, nitric oxide deficiency expressed as cold extremities. So an enzyme called NADPH oxidase, the NOx enzymes, these in the thyroid, these NOx enzymes are called DUOX1 and DUOX2. These enzymes increase superoxide, the reactive oxygen species, and the hydrogen peroxide. Environmental toxicities, mold exposure, mast cell activation, stress, chronic infections, or inflammation contribute to the upregulation of this NOx and DUOX, which increase the reactive oxygen species. When you increase the production of reactive oxygen species, you're increasing the oxidative stress, which downregulates the production of nitric oxide. So your TPO enzyme requires a specific amount of the hydrogen peroxide, and too much interferes with that action. So nitrites and nitric oxide inhibit the NOx and DUOX enzymes. Supporting the nitrate to nitrite to nitric oxide pathway may be an underutilized thyroid therapy due to its role in decreasing the production of superoxide and other reactive oxygen species by optimizing nitric oxide levels, scavenging reactive oxygen species, and supporting healthy circulation and microcirculation. So in the metabolic system, nitric oxide regulates carbohydrate metabolism and insulin production. It's emerging as a central regulator of energy metabolism and body composition. Insulin initially stimulates eNOS activity, increasing nitric oxide production. But insulin resistance decreases eNOS phosphorylation, which increases NOS uncoupling. This causes loss of endothelial function, increased expression of VCAM and other adhesion molecules, and increased oxidative stress. Remember I said that when you increase oxidative stress, you uncouple NOS more, increasing more oxidative stress. So we're on a bad, vicious cycle here. The GLUT4 receptor requires adequate nitric oxide in order to translocate, bringing glucose into the cell. Hemoglobin A1C binds tightly with the available nitric oxide. So this basically renders the nitric oxide not bioavailable. So it's not available to do all these other good things. Blood sugar dysregulations and oxidative stress affect the NOS pathway in a way that the nitrate to nitrite to nitric oxide pathway is not affected. The adrenal glands. Stress initiates the fight, flight, freeze response, while all the other non-essential functions like sex drive, reproduction, and digestion are acutely diminished. The adrenal glands require adequate nitric oxide in order to work effectively. And the glucocorticoid production in the adrenal glands is increased in the absence of nitric oxide. So cortisol is the only hormone that naturally increases with age. So cortisol inhibits both iNOS, thus the immune impairment, and the eNOS, the cardiovascular complications that we see with stress and age. Cortisol increases the reactive oxygen species, increasing that oxidative stress. Cortisol decreases the synthesis of BH4, which increases NOS uncoupling. And so all of these decrease the production of and or make nitric oxide not bioavailable. And DHEA is a prohormone which metabolizes into other estrogens and testosterone. It directly increases nitric oxide production by the activation of eNOS. And low DHEA levels are associated with a higher risk of ED in men and low sexual responsiveness in women. The sex hormones. Nitric oxide regulates hormone release in the hypothalamic pituitary axis. It triggers the pulsatile release of LHRH, which mediates the LH release. Then LH goes on to stimulate the production of steroid hormones from the testes, the testosterone, and the ovaries, the estradiol. And estrogen stimulates eNOS. Estrogen declines with age, with a resulting decrease in NOS function around menopause. And that's why 85% of the women in the US are hypertensive by the age of 85. And progesterone acts directly to stimulate eNOS, increasing nitric oxide production. And some recent studies have shown that nitric oxide could extend fertility. Nitric oxide appears to slow or reverse the aging of eggs in mouse ovaries. Studies suggest that nitric oxide may help women in their 30s and 40s remain fertile longer and increase their chances of having healthy babies. ED is ED. Erectile dysfunction is endothelial dysfunction. Often ED is one of the first signs of cardiovascular disease. So erectile dysfunction happens in about 20% of all adult males, between 30 and 50% of males between 40 and 70 years old, and more than 60% of men older than 70 years old. So nitric oxide plays a critical role in the initiation of the pressure for the erection and activates soluble guanyl cyclase to increase the cyclic GMP. This cyclic GMP relaxes smooth muscles for engorgement. The PDE5 inhibitors like Viagra and Cialis prolong the action of cyclic GMP to extend erections. They do not cause the erections. You must have adequate nitric oxide in order to get the erection initially. So these drugs are effective, are not effective in almost 50% of the men treated. Testosterone deficiency induces endothelial dysfunction. The deficiency can lead to erectile dysfunction and or vascular dysfunction. So there's a dual action of testosterone. It modulates the nitric oxide cyclic GMP signaling by upregulating NOS. Testosterone also modulates the PDE5 activity, maintaining the homeostatic mechanisms of erections. I want to caution on the use of aromatase inhibitors, the anastrozole, the letrozole, that sometimes they're put in testosterone compounds for testosterone replacement therapy for men, and the DHT blockers, the 5-alpha reductase inhibitors that are used for BPH and hair loss. Both of these may decrease production of nitric oxide and increase occurrence of ED and cardiovascular complications. On female sexual health, research shows that in the US, between 25 and 60% of women experience some sort of sexual dysfunction. Female genital arousal response is all mediated by nitric oxide. Nitric oxide is a potent vasodilator of clitoral, labial, and vaginal tissue, just like with the men. It increases blood flow in response. The increased blood flow means better orgasms. And nitric oxide decreases anxiety, which increases sexual pleasure. So nitric oxide acts like a neurotransmitter in the brain, modulating the release of oxytocin and LHRH. Both of these are central in the modulation of sexual behavior. So oxytocin, the cuddle hormone, the love hormone, increases nitric oxide through the NOS pathway, and in turn, orgasms increase oxytocin. However, you must have adequate nitric oxide in order to have an orgasm. So nitric oxide is involved in the creation of long-term memory. Memory and libido are closely connected. It enhances the ability to remember sex scents, the pheromones. Following sexual stimulation, it's nitric oxide that modulates lubrication. So as women, if we can't respond, if we're unable to feel and we're not lubricating, do you think we really think or want sex? Probably not so much. So SSRIs inhibit NOS, decreasing nitric oxide production, and blocks arousal in both men and women. So this leads to issues with desire, arousal, ejaculation in men, and orgasm in both men and women. Polycystic ovarian syndrome, PCOS, is related to insulin resistance, diabetes, obesity, oxidative stress, inflammation, and cardiovascular disease. All of these are mediated by nitric oxide. So increased oxidative stress increases NOS uncoupling. It decreases Treg cells, and they modulate the immune system, maintain tolerance to self-antigens, and prevent autoimmune disease. All of these are regulated by nitric oxide. PCOS increases ADMA, asymmetric dimethylarginine. This decreases the arginine bioavailability, competes with arginine in the NOS enzyme and uncouples NOS. ADMA plasma levels predict all causes of mortality. And the allopathic treatment for PCOS is birth control pills, but birth control pills uncouple NOS, decreasing the production of nitric oxide, increasing the oxidative stress, increasing this bad vicious cycle. And brain health. Blood flow to the brain carrying oxygen, nutrients, and glucose, removal of waste can affect brain performance, cognition, and sense of well-being. Nitric oxide is released during enhanced neuronal activity to mediate cerebral blood flow. Nitric oxide decreases neuronal inflammation and oxidative stress. So inflammation and oxidative stress are primary drivers of most chronic diseases, including mental health issues. So nitric oxide may be involved in the regulation of anxiety. Anxiety and depression are associated with low levels of BDNF. But nitric oxide mediates the neuroprotective actions of BDNF to promote neuronal survival and stimulates the process of neurogenesis, which enhances learning and memory. Nitric oxide plays a role in synaptic plasticity, which positively influences mood. Nitric oxide in the brain, it increases the GABA, the little calming neurotransmitters. So nitrates increase the production of BH4, This increases the production of the neurotransmitters serotonin, melatonin, dopamine, norepinephrine, epinephrine. And supporting the nitrate to nitrite to nitric oxide pathway will decrease oxidative stress and inflammation. And I know we keep coming back to this oxidative stress and inflammation, but it plays a huge role in the way the way our body functions. So sleep, mental health and sleep patterns have a complex and important relationship in regulating mood and emotions. REM sleep plays a significant role in maintaining emotional well-being and psychological balance. Nitric oxide regulates the release of acetylcholine and consequently the occurrence of REM sleep. When we lose the ability to produce adequate nitric oxide, sleep becomes disturbed. And decreased nitric oxide from aging is linked to impaired circadian rhythm. So in summary, nitric oxide production naturally declines with age, reducing to about 50% by the time we're 40, and as little as 15% by the time we're 60. So supporting the nitrate to nitrite to nitric oxide pathway not only increases nitric oxide directly, it helps recouple that NOS, which decreases oxidative stress. So we've got a good cycle starting there. So thank you for listening. I will take questions now if anybody has any.
Thanks.
Let me, there are all these references, and basically she is a wealth of information. I don't seem to get, okay, this out of that mode. I have some questions.
Today we're going to talk about the central.
So I am curious, first of all, how did you get started on this pathway? I want to.
Back in 2009, I helped formulate and develop the Neo40 lozenge. And I was in on the initial marketing and distribution of that product. So I've been in the nitric oxide space now for quite some time.
Okay, but what?
But the difference between
what led you into nitric oxide worlds of wonder?
Well, because when I helped with the Neo40, I learned the nitric oxide story. And nitric oxide is at the base of every single physiological function, every single one of them. Right. So if you don't have adequate circulation and microcirculation, that cell is not going to be able to be fed any glucose, oxygen, nutrients, and the debris is not being able to carry it away. So you've got to have circulation and microcirculation for everything. So back in 2009, I just started putting everybody on a nitric oxide enhancer. Because whatever you take or whatever you give somebody, it will work better if that circulation and microcirculation is open. Mm-hmm. And like I said, like the oxygen requires nitric oxide in order to be delivered to the cell.
Right. So what are some of those nitric oxide enhancers, and could you speak?
The Berkeley Life Professional, that's who I do consulting for now. This is a nitrate product, a nitrate-based product. And you can get nitrates from nitrate-rich veggies like arugula, spinach, celery, bok choy, beets. However, you never really know exactly how much nitrate you're getting. With the Berkeley Life Professional, 2 capsules will give you approximately the same amount of nitrate as 5 ounces of spinach or 7 ounces of beets, without the possibility of any oxalate issues, because some of those high nitrate veggies are high oxalate.
Right. Yeah.
But this product's only got 10 milligrams of fermented beetroot, so unless somebody's outright allergic to beets, as an IgE allergy to beets, they're able to take this product without having any oxalate issues.
Gotcha. Cool. And then what does BH4 stand for? I don't remember that.
BH4 is tetrahydrobiopterin. So BH4 is the required cofactor in the NOS enzyme to make nitric oxide, but it's also required in your production of your neurotransmitters, your serotonin, melatonin, dopamine, norepinephrine, epinephrine.
Gotcha.
And BH4 deficiency is one of the main reasons NOS gets uncoupled.
Okay.
But if you have any MTHFR SNPs, you're by definition BH4 deficient.
Yeah.
So these nitrates actually help increase the production of BH4.
Okay.
So you're going to help recouple that NOS. Because remember when I said NOS is uncoupled, it becomes a superoxide generator, not a nitric oxide generator. So when you recouple it, you're actually decreasing oxidative stress because you're decreasing the amount of superoxide being produced. Plus, you're helping your body make all those neurotransmitters.
Great. We all need a little more serotonin, dopamine, and, you know, those types of things.
We do. We do, because stress is a huge one to uncouple NOS. You know, like when people are really stressed, they get sick easy.
Mm-hmm.
And that's because there's 3 different NOS. There's your neuronal NOS, your inducible NOS, and your endothelial NOS. And the inducible NOS, this is the NOS that is part of the immune system. But stress downregulates that inducible NOS.
Yeah.
So your immune system is impaired.
Wow. Okay.
But stress also uncouples the eNOS, the endothelial NOS. And that's why when you're stressed, there's so much more cardiovascular disease, there's more strokes,
mm-hmm.
there's more high blood pressure.
Well, speaking
Right.
of an allopathic, perspective, like medical school, we're taught, and residency, we treat people with, we're taught nitric oxide in the form of pharmaceuticals.
Right. The nitroglycerin.
Yeah.
Uh-huh.
Glycerin for MI, if you're going in with a heart attack, but the longer acting ones for preventing angina and for blood pressure, and also, erectile dysfunction, as you mentioned. So those are, but we're not taught that nitric oxide has any other
right.
effects. And we're not really, I graduated in 2007, so maybe it's changed from then, but we're not really taught any natural ways to get these, nitrates into your body.
Right.
So obviously spinach and arugula, bok choy, celery and beets are great options for a healthy lifestyle, but I think you'd have quite a substantial amount, right?
You do. However, the DASH diet, the dietary approaches to stop hypertension, there is about 1,500 to 2,000 milligrams of nitrates per day in that diet.
Good.
And that diet works. However, it's pretty hard to follow because it is so vegetable intensive.
Right.
But the Mediterranean diet also has a high nitrate concentration.
Right. I love all of it. And then you can't negate the effects of calcium and the other micronutrients, potassium, the electrolytes, and in helping that, magnesium, they all kind of play a factor in endothelial, blood vessel function.
Well, the Berkeley Life Professional has some magnesium in it, and the type of nitrate in it is potassium nitrate.
Oh, well, there we go.
And then it also has some vitamin C, Because vitamin C is the only molecule that can reduce, like when BH4 is used, it gives up an electron and it turns into BH2. And if you don't have vitamin C there to take that, it turns into BH3. And if you don't have vitamin C there, that BH3 will go down to BH2. But if you've got enough vitamin C there, that BH3 will go back to BH4.
Okay.
Because BH2 will uncouple the NOS enzyme.
Okay.
So the vitamin C is in there too. Plus a little bit of thiamine. Thiamine works for the endothelial layer and is also good for the blood sugar.
Great. Yeah. We hear of beriberi, but that's a little extreme version of thiamine deficiency. So what are some, so for someone who's not a wellness or health professional, how can they learn more about this or, you know, get started?
Well, we can go to berkeleylife.com. And then if you're a professional, click the key up there that says practitioners. But also I've got a bunch of videos up on YouTube. So go to Berkeley Life Professional and click on that. And I've got videos up there on nitric oxide and immune health that I put out like back in April, talking about how the nitrates and melatonin and vitamin C will actually help prevent and help recover. And then I've got nitric oxide and mental health, and nitric oxide in sexual health, and nitric oxide in hormones. But in this little video that I did for this, I tried to put a little bit of all of it in here.
Yeah.
But
Yeah.
I go a little bit deeper into it. Plus, I'm just now finishing up my nitrates and nitric oxide and intestinal health. So that should be out. That should be out shortly. The paper should be out shortly, and then I'll start doing some videos on that too, where I talk about how nitrates protect the microbiome. And if anybody's on any kind of antibiotics whatsoever, I recommend being on a nitrate supplement, because this will actually help you to not get leaky gut and dysbiosis.
So what if you already have those types, you already have?
Then this helps actually repair that.
Okay.
The nitrates increase the population of the good bacteria. And also it helps close those tight junctions. Nitrates like decrease the occludin and the claudin that are increased with dysbiosis.
Cool. Wow.
Yeah.
So it's a deep, the rabbit hole to go down, and you know there's a lot to learn and a lot of different pathways, and it's quite a lot. Yeah.
Well, it is. It touches every single physiological function.
Yeah.
And but talking about it being a rabbit hole, I think that's probably one of the reasons why it's not so widely known. It is because it's so wide and encompasses everything that it's challenging to understand how this one molecule, nitric oxide, a gas, is so ubiquitous in every single physiological process.
Yeah, it's kind of like CoQ10 being called ubiquinol, you know, because it's
everywhere.
Right.
Yeah.
I wonder if there's another Latin name that could be made for nitric oxide. Even more.
It's a magical molecule.
Yeah. Cool.
There's something like they in 1998, like 3 3 men won Nobel Prize in science for the discovery of nitric oxide. And since then, there's been almost like 200,000 papers written about nitric oxide.
Wow.
Yeah, it's a lot.
Well, let me just check and see if there are any questions. I don't see any currently from the group, but I'm sure people have questions, you know, once they watch the replay.
Yeah, just ask me anything. I'll be glad to respond.
So your email, people can find you through Facebook, email, emails. You posted it at the end of the video, but let me, should probably get it, or you could say it. Oh.
Well, that's for if somebody wants to open an account with Berkeley Life, Donna can do that for you. I know that you'll be carrying the Berkeley Life Professional on your store, on your Get Healthy store. So that would be an excellent place to obtain it.
And I have the test strips, and I've been taking it for a couple of weeks now and testing and whether or not I'm low on nitrite, because it's in oral mucosa. And yeah, I definitely go up through the day.
Yeah. And what you ate, and yeah. So we swallow the nitrate, it gets absorbed, gets concentrated in the salivary glands. The salivary glands release the nitrate, and we've got good anaerobic bacteria on the dorsal aspect of our tongue that will reduce that nitrate to nitrite. So the test strips test the nitrite in your saliva.
Why don't
we swallow
for nitrate? Is it?
Pardon?
Why did y'all select to test for nitrite versus nitrate?
Because it's the bacteria that do the reducing. Okay? And so this will tell you the health of your oral microbiome. And also the nitrite is the immediate precursor to the nitric oxide. And nitrite levels do correspond with changes in blood pressure, changes in exercise endurance, with changes in nitric oxide. Okay. So then when we swallow the nitrite in the acidic environment of the stomach, some of that nitrite gets reduced further to nitric oxide. So this actually helps against H. pylori.
Okay.
And most of the nitrite gets absorbed and is a storage form for nitric oxide. And in all of our tissue, we have different tissues that have nitrite reductase. So like I said, the myoglobin in the muscle can take that nitrite and make nitric oxide out of it. Okay. So that's why when you're exercising and stuff, when you need more circulation, the myoglobin kicks in to reduce that nitrite to nitric oxide. But you have to have the base.
Right. That makes sense.
Okay, you've got to have some, like the base of having enough nitrite there, or having like a functioning NOS enzyme. Okay. But the nitrites help that NOS function.
Right. Okay. That makes sense. So cool. Well, thank you.
Well, you're welcome. Thank you.
For a wealth of information.
Like I said, if anybody has any questions, just shoot them over.
Yeah. We'll keep an eye on the comments, you know, as the videos.
Okay.
And thanks so much for your time and your expertise and all the things you do to help.
Thank you, Ashley.
All right.
All right.
Thank you. Have a good one.
Thank you. All right. Bye-bye.